When it comes to resurfacing treatments, I want to be really transparent with you all. As a corneotherapist, aggressive exfoliation, chemical peels, and controlled wounding are not my first choice of long-term skin health. They're not how I prefer to work when the goal is resilient, self-regulator, and barrier-functioning skin. But I also understand reality. Many of you work in clinics where these treatments are part of the menu. Sometimes it's protocol, sometimes it's the client expectations, and sometimes, whether we love it or not, resurfacing is going to happen. So if a procedure is going to be done, what happens afterwards becomes absolutely critical. Because the success of that treatment isn't decided in the treatment room. It is decided in the weeks before and the hours, especially the first 48 hours that follow. If we get that window wrong, we don't just risk delaying healing, we risk chronic inflammation, barrier dysfunction, and long-term sensitivity that can take months to undo. If you are new here, welcome. I'm Renee Sorbonne. I teach advanced skin science through a corneotherapy lens, and we focus on barrier physiology, formulation logic, and clinical decision-making that prioritizes skin integrity over trends. This channel is about understanding how the skin actually heals so that we stop accidentally pushing it into dysfunction in the name of results. Now, let's put the science into practice. When we perform resurfacing treatments like chemical peels and laser resurfacing, we intentionally disrupt the skin barrier. We strip corneocytes, we trigger an inflammatory cascade, and dramatically increase transepidermal water loss within the skin. It's not stimulation, it is controlled injury. Now, this is where the first 48 hours of our job is not to speed things up or push actives. It is to keep inflammation from going too far and support the skin while it does what it already knows how to do. And that means two priorities always: controlling inflammation and supporting barrier repair. And this is where less truly becomes more. Let's start with the first 24 hours because this is where I see most mistakes. Immediately after the procedure, the skin is extremely fragile. Cleansing has to be conservative, and this is not the time for the client's regular cleanser. Foaming cleansers, surfactants, and emulsifiers can do real damage here during this time. So ideally, cleansing is limited to cool water. If something more is needed, it should be a product that can be removed gently, without rinsing, and without stripping away what little lipid structure remains. Actives are a hard no. No vitamin C, no retinoids, no exfoliating acids. The skin is wounded, and adding actives now doesn't accelerate healing, it fuels inflammation. And this is where barrier support matters the most. The skin needs structure, not stimulation. Formulation should support the lipid matrix using ceramides, fatty acids, and cholesterol that is compatible or biomimetic lipids. And that will help to organize the lamellar structure. Ingredients like phospholipids are especially helpful because they mirror the skin's own membrane architecture. And if there is UV exposure at all, physical sun protection is a non-negotiable. Compromised skin does not tolerate chemical filters well during this phase. Now, once you move past the first 24 hours, the skin is still inflamed, absolutely, but now it begins to rebuild, and this is where we can carefully layer in some more support. Cleansing stays gentle and minimal. Often, once a day is enough unless the skin has been exposed to significant debris. Now hydration is going to become appropriate. Humectants can help the skin hold on to water, but they do need to be chosen wisely. Hyaluronic acid can be helpful, but ingredients that support the skin's natural moisturizing factor like urea and amino acids are often even more effective during this time. Now, remember that application matters here. Humectants go onto damp skin and they must be sealed in immediately. So this is also the window where anti-inflammatory products make sense. Not suppression, but modulation. Ingredients like panthenol, beta-glucans, green tea, or licorice root, they all can help to calm redness and support the healing cascade. But none of this matters if you don't seal it in. So hydration without better support increases water loss, and every single time it does so. So that final step is a protective barrier cream, and it is essential. Now, just as important as what clients should do is what they need to avoid. Heat is a big one. Hot water, steam rooms, all of this amplifies inflammation. Picking or scrubbing and peeling the skin dramatically increases the risk of post-inflammatory pigmentation and also prolonged sensitivity. So even harsh towels, over-cleansing, or introducing new products during this window can undo all your good work. And here's something that I can't stress enough. Your instructions need to be written for your clients. Clients do not retain verbal information, and when their skin is red, tight, and uncomfortable, it literally goes out the window. Clear, simple written aftercare protects the skin and it protects your outcomes. So here's the big takeaway. Even if resurfacing isn't your preferred modality, post-procedure barrier management is everything at the end of the day. When inflammation is controlled and the barrier is supported correctly, healing is fast, more predictable, and far less likely to turn into chronic dysfunction of the skin. Now, that's the difference between short-term results and sustainable skin health. If you'd like clear practitioner-ready 48-hour post-procedure aftercare guides, then I have created one for you to download. And all you have to do is join my Skin Strategy Collective group. It will be in the research tab waiting for you, and the link is in the description below. Now, it is designed to be simple, science-backed, and easy to hand to clients or staff, and you're welcome to customize it to your clinic needs. And if this barrier-first way of thinking resonates with you, then this is exactly what we build on inside the Professional Skin Assessment Mastery, where physiology, formulation, and clinical decision-making come together into a repeatable framework that doesn't fail. Thank you so much for spending your time with me. Please like, share, and subscribe, and I will see you next week.